My pleasure to introduce our speaker, Dr. Dalal Salim Al-Dosai. Dr. Dalal, she has a lot of experience in pediatric oncology, and today she's going to talk about really very important topic, and definitely you are going to gain information from her. She's a senior pharmacist in King Saud Medical City in Riyadh, Saudi Arabia. So please join me to welcome Dr. Dalal Al-Dosai. Go ahead, Dr. Dalal.
السلام عليكم ورحمة الله وبركاته.
عليكم السلام.
الله يسلمك، والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد، اللهم صل وسلم وبارك عليه. Welcoming and greeting to all audience that we have your time, precious time to attend this really hot topic which really يعني يمس شريحة كبيرة من حياتنا اليومية وحياة العمل.
Excuse me, Dr. Dalal, because some of the attendees, this is global, some of them, they don't speak Arabic. So if you just speak in English, so all of them will understand the presentation. Thank you.
Yeah. First of all, I will pass my deepest gratitude to Dr. Najwa and to the Health Global Activities for inviting me to such meeting, awesome meeting. I am here today, as you can see in the screen, in this topic, decreasing medication error related to chemotherapy in pediatric patient. Decreasing, I didn't say prevent. Prevent is not accepted word in such topic, which medication errors. Why? Because still, human is error. We are human being, still. No one come to hospital to do mistake. It just happened by accident. And once the breakdown happen in this chain, we have to know what is the cause leading to such error. Don't blame the people, blame the system from A to Z. This is the point. And especially when the error happen in high-risk patients, such pediatric or geriatric, all of us, we have a lot of patients, but some group is very important to deal with them specifically. Pediatric patient is high-risk patient. Okay, today I am going to talk about the chemotherapy medications error occur in cancer treatment programs in pediatrics. As you know, our body are made up millions of cells, which normally are renewed in controlled way. That to say, remaining our bodies healthy. Sometimes no one know why. This control lost, and the cell keeping duplicate themselves. Solid groups of these cells is called tumor. Malignant tumor cells may travel to lymph nodes or through the blood stream to other parts of the body. Spreading from organ to another, this is called metastatic. Not all cancer are metastatic. Cancer is not contiguous and cannot be spread from person to another. Consequences either enhanced toxicity or impaired disease control. In this lecture, we are going to discuss common medication error that occur in pediatric and neonatal patient care, describe the error reduction strategy, not preventing, as I said before, for the pediatric and neonatal patient, describe the role of interdisciplinary team in decreasing such medication error. All of us have a role in home or in work. Every one of us have a role. But when come together to improve the culture and the media of the work, this what giving us the positive feedback on the patient safety. Next. As you know, this is the by form of National Coordinating Council of Medication Error Reporting and Preventing. You can see the purple part A, B, C, D. The error happen with harmless, no harm. When the green color begin until H category, there is harm on the patient. and no one, we don't wish to come to this part. The red part is sentinel effect or the medication error, and can be dangerous or cause resulting in the death of the patient or compromise the patient. Incidence of adverse drug events. Pediatric medication error rate approximately equal to the adult rate. Error in pediatrics 3 times more likely to be associated with potential ADE. Neonatal ICU, which this is patient of group with highest error and potential ADE rate. 74 of errors and 79 of potential ADEs occur in ordering or prescribing stage, especially in pediatric, as I said before. I am talking now in pediatric, not adult. And this is depending upon the research and the study. This is the rate and the percentage. Reason of this increased risk and the breakdown have been different and changing in pharmacokinetic parameters, lack of pediatric formulation, dosage form, and also guidelines for the pediatric specialty. Calculation errors, inconsistent measurement of preparations, problem with the drug delivery system. Lacking of pediatric formulations, this may lead to crushing tablet, opening the capsule and adding to the food and the beverage, utilizing IV formulation for the oral use, using ophthalmic preparation in ear, giving oral anticonvulsants sometimes rectally, compounding extemporaneous product also. Source of errors, we continue, confusion between adult and pediatric formulations. Lack of, as I said, lack of formulations specifically for pediatrics. We are suffering from lacking, really, until now, we are suffering from the lacking of pediatric formulation. Confusion among oral liquid concentration, look-alike and sound-alike, which is similarity, phonic, and in packaging name. And this is not happening in our country only, globally. Globally, look-alike, sound-alike. LASA is the accusing group of medications that may lead to errors, especially in pediatrics. Multiple dosing regimens, this is one reason for the errors happen in pediatric. If we make comparison between adults versus pediatric formulation, different concentrations, different volumes, and also all this should be stored in separate locations to avoid error within the pharmacy, also in nursing units. LASA medication names, medication packaging, misunderstanding or mishearing the medication, preparation the medication for the patient, confusion between IV and oral products. This problem has been increased in pediatric as a practice of using IV medication for oral administration, as I said before. Calculations error. We shift now to calculations error, which may also lead to big problem and really serious problem in pediatric. Miscalculation error, this include error in unit conversion between millimole or milli equivalent, milli or unit, miscalculation of body surface area, misplaced decimals, compounding error. It's 10-fold, you can imagine 10-fold errors. Miscalculating rate of infusion, weight-based error, using wrong weight or old weight. Suppose one patient have filed since 5 years ago, but still the weight as it is, no updating for the file. It's the same weight, the same age. This is really source of error. So updating and customization the system. As I said, don't blame the people, blame your system. Okay? Expressing weight in libra, it's wrong. Instead of a kilogram, all all the pediatric expression, the unit in kg. As I said before, cancer medication and the teamwork, everybody in the regimen treatment for the cancer have a role. Healthcare providers play a role when you use a cancer medication at home. Some medication cancer using by oral or IV. Patients have also role in expanding most of chemo medication error occur at hospitalized patients. Most of cancer medication error happen inside the hospital, not at the home. As I said before, in prescribing or ordering stage. Medications to treat cancer is divided cytotoxic chemotherapy, which group of medications stop the cancer cell from dividing. Immunotherapy, type of cancer treat and help your own immune system to fight cancer. Targeted therapy, drugs that target specific mutations or specific protein within cancer cell. Supportive care medications, which before using the oral or IV medication, there is support care medications. Also some medication will happen in this stage. What kind of these medications? Prevent nausea, prevent reaction from IV drugs, prevent diarrhea and or constipation, increase the white blood cell. As you can see in normal daily work, some patients receive pelgrastim. Okay, this is the reason for using pelgrastim to increase the white blood cell, also to treat blood clot because of using some IV drug chemotherapy. What is the goals of the cancer treatment? New adjuvant, which shrink the cancer before surgery. Adjuvant reduce the chance of cancer coming back after surgery, and metastatic, which will shrink or control cancer growth. And this is called it palliative. Cancer treatment plans, also, regimens, combination of cancer medication, oral and IV, plus supportive care medication. Sometimes oral and IV, also plus supportive care medication. As I mentioned before, treatment cycle time period medications are given, counted in days. Treatment occur on day 1, usually dispense 1 cycle at the time to increase safety. Also, it may include cancer medications, IP cancer medication, or both. Sometimes the treatment, cancer treatment plans include radiation therapy. Radiation may be given before, after, or during the medication. Unwanted, of course, the chemotherapy have unwanted adverse drug effects. Cytotoxic drug drop in white blood cells, platelets, which affect also stomach, vomiting, diarrhea, hair loss. Targeted therapy causes skin rash, sensitivity to sun, diarrhea, change in the blood pressure or heart function. No signs, symptoms of cancer versus unwanted effect of medication. Write down symptoms you have. Ask how to identify which symptoms require immediate medical attention. This is the way for the patient himself. You can guide him to follow this advice. No signs, symptoms, cancer versus unwanted effect of medication. Write down symptoms you have. Ask how to identify which symptoms requires immediate medical attention. Tell a provider about symptoms, unwanted effect. Tell your provider about the missed doses. If you didn't get the dose, tell him the missed doses. True or false? Oral cancer medication have less side effect than injected IV medication. What do you think? Is it right or it's true or false?
You can write your answer or if you like to speak, we can allow you to speak as well,
Yes.
just to share your opinion.
Oral cancer medication are safer to take than IV medications. Drug interaction. This is patient story. Drug interaction may occur with any medication, not only the chemotherapy, any medication, there is drug interaction. I mean, prescription drug interaction will happen in prescribed or over-the-counter OTC, vitamins, minerals, herbal, or folk medicine, natural products, specific food, and alcohol. All this can be harmful and reduce the effectiveness of the treatment, especially the chemotherapy, rather than the other medications. You can prevent harm from drug interaction, yes. Use the same pharmacy. Keep a list of all medications. Work with your pharmacist. Share your list with all healthcare providers. Read instruction on the label on all medications bottles. Always read auxiliary label and other handout given. Auxiliary label will give you indications really, and sometimes safe, maybe safer. Also know names of your medication, and this is awareness, patient awareness himself, self awareness for the patient. Know names of your medication, generic and brand, both. Of course, we depend as healthcare provider, we depend upon the generic, but also brand is sometimes is needed. Know what your tablets and capsule look like. Update yourself. Be attention to your medication. No one knows about your medication rather than you. Spell your drug names for healthcare provider. Check 5 rights, patient right, medications, right dose, right time, right route. If a medicine does not look or sound right, ask the provider to check. Some company, they change the packaging of the medication. So now, before we have loose tablet of methotrexate, now we have strip. You can cancel the patient. This is the same medication, but it is the other company. This is a simple thing. Maybe some patient take this and the other one, both of them. They don't know about the medications. And this is your mission. And this is your mission and vision, to help the patient to get the right medication, not only chemotherapy, all medications. Safety in your home. Do not spill or crush cancer medication at all. Never ever split or crush cancer medication. Don't tell the patient, open the capsule and mix it to the food or beverage. No. But sometimes the remaining of the food being on the dish and the other one come and take it, and this is be disaster really. Tell your pharmacist if you cannot swallow the drug whole. This is counseling for the patient. Store drugs in a secure place away from the heat and moisture. Store drug out of the reach of children. Take medications to a pharmacy for disposal. Don't throw them chemotherapy at home. No, take it to the pharmacy and they will deal with it in specific as per policy and procedure. Safety also in your home. Hazards medication. Home, many cancer medication are hazards. And all of us, the tendency, about the hazardous medication. It can harm a healthy person. Limit exposure. Ask if your medications as hazards. Learn safe handling of medication. Learn safe clean up of the body waste. Wear gloves when you handling the tablet or capsules. Wash hand after removing gloves. Body waste is contaminated for about 48 hours. 48 hours, it will be active after the last dose of medication is taken IV or oral. IV or oral, 48 hours is active, the medications. So you have to tell the patient the waste, okay? The wastes or the extract of his body could be يعني handling or remove يعني contaminated, okay? And use the right way to clean up this waste. As I said, wear gloves when you clean up waste. Wash hands. Well close toilet lid وانتم بكرامة. Lid toilet lid and flush twice. Hazard medication. If a spill occurs, use the spill kits is provided. Wear gloves when you clean up. Wash solid clothes separately. Wash surfaces twice. Now I will move to another strategy for medication error reduction strategy. Implementation of the strategy of the medication error reduction, not prevention. I said no one of all of us, no one cannot prevent error because human is error. It just happened by accident. But when the breakdown happened, as I said, don't blame the people, blame the system, and you can make the negative thing positively. And this is the target of reporting of medication error. This is the target, to be safe, both of us as healthcare provider and as patient. Strategy to decreasing potential error in pediatric patients, improve communications among physicians, nurses, and pharmacists. Be healthy, be open-minded, communicate when you feel there is something wrong. Don't be silent. Always contact the physician, nurses to discuss respectfully and to deal with this, just for focusing on this error and discuss it respectfully. Unit-based clinical pharmacists making rounds with the healthcare team use the computerized prescribe order, enter CBOE with decision support. Staff competency, and this is very important, required math competency for all staffs. Develop competency for entire team before new services is implemented. Provide the resource for maintaining competency for pediatric and neonatal pharmacology. Ensure competency in all staff shifts. All shifts, not only the morning shift or afternoon, also the night shift. All shifts of the pharmacy. Patient information. Provide patient age and date of birth. Decrease the risk of confusion age in years versus in months, because all the doses in pediatric or in unit based on kg. Weight and height metric measure only patient medication history. It's very important. Includes concentration of all medications, record doses in milligram, not in volume. Specifically ask about common OTC, acetaminophen, ibuprofen, vitamins, all these medications. As I said before, know your own height and weight. Update the weight on the system, not before 5 years and the patient come now. There is variation, sure. Provide a frame references. Know your height in centimeters. Know your weight in kilograms. Now we will move to reduction, as I said, on prescribing error, which have the highest rate in the chemotherapy medication error. In our hospital, I noticed the medication error happen in this stage, prescribing also in administrative. When I interact and follow the medications, I found the prescribing مسجلة أعلى prescribing error is the most rate in the chemotherapy medication error. Alkylating agent, anthracycline, alkylating agent like what is that? I remember cytarabine, methotrexate, and cytarabine, methotrexate. I forget one. Sorry. As I said before, verbal order. There is no verbal order in chemotherapy. Keep in mind. no verbal order in chemotherapy. Verbal order for the other medications. It's not allowed to get verbal order in chemotherapy. Also, reduction in calculations error, establish reliable method of providing current patient weight, as I said, in kilogram to the healthcare team, require calculate dose and dose per weight, that to say in milligram versus kg. On each order, require independent double check of dosing calculation. Independent double check. Before independent double check, dependent self-check. And I encourage to do this before the independent double check. Always they said, activate the independent double check. Before this, activate the self-check. Then move to the other part, the independent double check of dosing calculation. Reduction in dispensing errors, standardized concentration, use one constant formula or standard concentration, use commercially available unit of use preparation whenever feasible, have pharmacy prepared all IV admixture and oral liquid preparation, independently double check prior to dispense. Lastly, and finally, this is my research has been published, and really we do it a retrospective study in pediatric medication error, and it's published and it is on the site. Everybody is so welcome to read it, and really it's really interesting because I'm interested really in this field, and by passion, my passion, it's really to reporting and interact medication error. But as I said before, no one come to hospital to do mistake. It just happened accident, and the breakdown happened, and this is change depend on the system. So we have always hand by hand to one target in our life is patient first, and patient safety is the umbrella for all of us. Finally, I would like to pass my gratitude, as I said before, to the organizer for this really awesome inviting me to, and for all the audience to have their precious time to listening to me. And thank you so much for hearing